Market Aurora.
Thank you, Speaker. To the Minister of Health. Speaker, I want to commend Mr. Malcolm Bates, the Director of the Emergency Health Services Branch, for his integrity. Because yesterday Mr. Bates produced documents that Deputy Minister Saäd Rafi refused to produce despite a formal request by the committee investigating the Ornge scandal. Those documents confirm that Associate Deputy Minister Hugh MacLeod and Minister of Health George Smitherman told the Director of the Emergency Health Services Branch that Dr. Chris Mazza would now be his boss. The very branch of the ministry that was to hold Ornge accountable was now directed by the Assistant Deputy Minister to do whatever was necessary to support Dr. Mazza in implementing the scheme that would ultimately defraud taxpayers and put patients at risk. Why would the Deputy Minister want to hide this information? What else is he hiding, and who is he trying to protect?
Minister of Health.
Well, Speaker, once again, it's part of the story. I think, Speaker, it's important that, and I'm happy to read from yesterday's answer from committee. So Mr. Bates, and I agree with you, he deserves to be commended for his integrity. He is a very, very fine public servant, and we are all grateful for his contribution. So Mr. Klees was asking Mr. Bates some questions, and he said, well, as I said, it was in 2003, it was relatively clear to me that because I met with Mr. Michael Mianis, the Chief of Staff to Associate Minister Dan Newman. That, of course, is a Conservative. And at that particular point in time, Mr. Mianis was very clear with us that the proponents of this particular service change wanted it done and wanted it done quickly, and the Minister supported that.
Thank you. Supplementary.
Speaker, the Minister forgets that there was an election. There was an election, and guess what? It was a Liberal government. It was Minister George Smitherman who implemented the program. Mr. Bates had the integrity to recognize that the motion that we put forward was in fact the information that we were requesting. That's why he produced the documents that responded to the committee's request. That stands in direct contrast, Speaker, to the persistent, obstructive, and the defensive posturing of this minister, her several deputies who have refused to provide information. Here's what is encouraging, Speaker. We know that there are many, many more Malcolm Bates in our civil service who will help us get to the bottom, help us get to the truth about what happened, when it happened, and who was responsible.
Thank you. Minister of Health.
Speaker, if the member wants to talk about what's going on in committee, Speaker, I think we need to talk about the amendment, the motion that party has tabled, Speaker, that will choke off funding to Ontario's air ambulance service. Speaker, they are playing partisan games with people's lives. I think it is about as low as anyone could go. So, Speaker, I want to say to the member opposite and to the party opposite, stop grandstanding, stop playing political games with people's lives, stop playing partisan politics. Withdraw your motion to choke off funding to Ontario's ambulance. Start being part of the solution. Pass Bill 50.
You seated, please. You seated, please. New question. The member for Park.